Do I have multiple sclerosis? Do I have MS? It's a terrifying question. You will not believe how many people come to neurologists that think they have MS. So do I have multiple sclerosis? Well, multiple sclerosis is a autoimmune mediated inflammatory disease that attacks the myelinated axons in your brain. So your body is actually attacking itself. It can cause variable symptoms. I'm telling you, if you go on the internet and look up any symptom, and a lot of y'all have done this, probably all of you have done this, it always comes back to cancer or MS, sometimes ALS, but it always will circle back around to multiple sclerosis or cancer. So the symptoms can be very, very different in different people and very general. So the most classic symptom of MS is optic neuritis, where you just go transiently blind in one eye. And it oftentimes will get better with treatment. It may have happened 20 years ago. Sometimes someone comes in with a new event and you'll ask them, oh yeah, when I was 20, my right eye went blind and it got better. That's the classic, first MS event. But very few people have that, but that's the most classic. All the rest of them can be very vague, and I like to sort of start at the head and work my way down. You can just be dizzy, be dizzy. How many of y'all have been dizzy? Probably everybody listening to this video. You can have double vision. You can have facial numbness. You can have speech and swallowing difficulty. You can have numbness of your chest. Whenever I hear a patient that has like a band-like numbness across their chest, I think of multiple sclerosis and transverse myelitis. You can have gastroparesis, where your food doesn't move down and digest well. You can have incontinence. You can have neurogenic bladder. You can have sexual dysfunction. You can have these stroke-like symptoms, numbness in your arms and legs. You can just feel weak. You can feel tired. So oftentimes very vague symptoms. People don't just come in with an episode of optic neuritis or come in with a stroke-like symptom. And many of the patients we diagnose with MS come in with just very unusual symptoms, and they just had an MRI and we're looking at the MRI. So do I have MS? First thing that I would do would be get an MRI of the brain. People come into my office and I really many times think there's really nothing wrong with them, but they believe they have multiple sclerosis. There's nothing I'm going to be able to do to, dissuade their opinion to that without an MRI. An MRI has been a life changer. I first trained before we had MRI, so diagnosing multiple sclerosis was extremely difficult until the later stages. MRI is great. It shows these white matter lesions, and I'm going to show you a couple. This first one, it just looks like somebody just took an eyedropper and dropped oil, that white oil, those white spots in the middle on this film. And the second one is more diffuse, but the lesions you'll see are very periventricular, that hollow area in the center part of the brain. They're right against the ventricle and sometimes point at each other, what we call Dawson's fingers. So you have an MRI like one of these two, and there's very few things that look like this but multiple sclerosis, and we'll go over that differential in another video. And what else do you need? Well, I remember when we first started diagnosing multiple sclerosis, when MRI came out, we said if you have two separate attacks of MS in two different times in your life, in two different spaces in your brain, you have MS. And we use that as the main criteria. In 2017, McDonald came out with a criteria, and it still pretty much was that, two separate events, two different times in your life and two separate lesions. Now, there are other ways that we add up MRIs, lab work, spinal fluid results, evoked potentials to make the diagnosis. And we'll talk about this in another video. So when you go to a neurologist and you get an MRI of the brain and it shows white matter lesions, we usually do an MRI of your cervical spine and then decide if we need to do an MRI of your thoracic spine. This MRI that we're showing you now shows classic transverse myelitis. You look at the center of the spinal cord, that white area. And this next video is the normal one, with just a normal spinal cord. And then I'm going to show you again the abnormal so you can see the difference. So this third one is the same one, abnormal. And if there's some suspicion, you do an MRI of the thoracic spine. We also do spinal fluid evaluations. We check 3 markers in the spinal fluid. We don't do a lot of evoked potentials anymore. Very few people do them. They've sort of gone out of vogue, but it's really helpful to get a visual evoked potential particularly if you're in a diagnostic phase. So, do you have MS? If you think you have MS, the first thing I would do would be see your primary care provider or a neurologist and get an MRI of the brain, because you're not going to be convinced otherwise. So we're going to do some more videos on multiple sclerosis, and we're going to talk about treatment. Treatment is so important. Disease modulating therapy is so important. So more later.